Let's talk about prostate. So first off, which patients are typically being radiated?
In the modern era, as we've gotten more and more precise and our side effects have gone down and our cure rates have gone up, now it's pretty much wide open where pretty much anybody who's eligible for surgery would also be eligible for radiation. So there's not that big of a divergence as there once was.
And is the main selling point, because most patients just want things taken out, right? I have cancer, take it out.
100%.
So is the reason that a person might select radiation therapy, especially if it comes with androgen deprivation therapy, because of the sexual function and urinary function? Like, what's the main advantage?
Those are number one and number two. Yeah, lack of incontinence and lack of impotence. But of course, when you have androgen ablation, that sort of clouds things a little bit. But typically, the number one thing we see is patients who don't want to deal with diapers. So the dose to the penile bulb, the dose to the rectum, the dose to the bladder are so low now that the side effect profile is essentially zero from a radiation standpoint. Now, they may be having hot flashes from the androgen deprivation and decreased libido and fatigue, as you know. So the quality of life, those are the reasons why people tend to choose radiation. It comes down to two things. You want to be cured. Cure rate is key, but quality of life is equally important, if not more important, for most people. And so now that cure rates with our modern focused radiation allow us to get such a high dose into the prostate, we can say that they're essentially equivalent to surgery. So we don't have that deficit like we did 20 years ago when our fields weren't as precise. It was sort of the shotgun approach versus our, sniper approach now.